Hi, this is Dr. Sujoy Sanyal. I am a senior consultant neurosurgeon at NH Institute of Neurosciences, Rabindranath Tagore Hospital, Calcutta, India. And they are my friends from Mauritius, Anju and Deepak. They have now become my friends, but Deepak was originally my patient. Okay, so they have come all the way from Mauritius. So Deepak had started suffering from Parkinson's disease in 2010, and initially he did well, and thereafter he started becoming worse. And when he started becoming worse, he even visited Paris, and then he found his way to me in Calcutta. So when he came, he kind of researched the net, and he found out that I had pioneered deep brain stimulation surgery or brain pacemaker surgery for advanced Parkinson's disease in eastern India, and he came all the way to me in Calcutta in March 2019. So when Deepak came to meet me in March 2019, he was in a terrible condition. I still have those images fresh in my mind. He used to take 4 levodopas a day, and following every medicine, he used to have 2 hours of uncontrolled abnormal movements. He used to literally jump about. He could not sit in one place. And after the medicine effect wore off, he used to become completely stiff and immobile. So you can understand the pitiable condition that he was. And fortunately for both him and me, he even though he had visited Paris and met doctors there, he came all the way to me in Calcutta, and I explained to him about the benefits of this surgery. And in March 2019, he underwent brain pacemaker or deep brain stimulation surgery. This surgery involves placement of 2 electrical leads through 2 small holes on each side of the brain at a spot, in a 5 millimeter spot deep inside the brain on both sides, and then you tunnel the leads underneath the skin, and then you connect them to a battery which is placed here underneath the skin. So he underwent this surgery in March 2019 for severely advanced Parkinson's disease, and he stayed in hospital for around a week. And I asked him to stay in Calcutta for around a month, and after he completely recovered to my satisfaction, I sent him home to Mauritius. And the important thing about this surgery is that the pacemaker needs to be programmed from time to time, which means you might have to make changes in current being supplied to the brain. So for my outstation patients who are staying abroad or outside my homes, outside my state, I use WhatsApp to help them program the pacemaker. So I have a master programmer with which I can change the pacemaker settings, but my patients are given a remote by which they can themselves change the current being supplied to the brain. So what they do is that what they did over the last 5 years is that they kept in touch with me on WhatsApp. They used to send me videos, and I used to advise them to increase or decrease the current, and that's how we managed to program the pacemaker even from far. And it's a matter of extreme happiness for me that Deepak has gone on to do so well. He drives, he goes to office. He and his wife, they go on vacations together, and I'm so happy that they have come to me to visit me 5 years following this surgery, and I see him as a perfectly normal human being today. This gives me extreme satisfaction, and I am really one of the happiest surgeons in the world today to see my patient who have patients turned friends doing so well. Thank you so much.